मेडिकल फेयर इंडिया का आयोजन प्रगति मैदान दिल्ली में किया गया। इस फेयर का मेन अट्रैक्शन था मेडिकल डिवाइसेस और इक्विपमेंट की एग्जीबिशन। इस फेयर का एक इम्पोर्टेंट पार्ट बन गया मेडिकल डिवाइसेस का रजिस्ट्रेशन। इस मौके पर क्वेश्चन आंसर सेशन का आयोजन किया गया।
What is expected in the regulatory environment of India and the medical devices in the coming time, and probably we hope this year itself. So the Indian Health Ministry is planning significant changes to its regulatory approach of medical devices. Revisions would include firstly defining and regulating medical devices separately from drugs, although this would come in the Drugs and Cosmetics Act amendment itself, which is under discussion, and then bringing all the medical devices under regulations in India, which is only 22 categories of medical devices regulated as of now. If you compare this number 22 with the number of medical devices under the nomenclature of GMDN, which is 14,000, you see the percentage. 22 types regulated out of 14,000, which is a big difference. So after the medical devices comes under the regulatory board, we also try to establish a risk-based device classification system. Like US FDA, everyone have risk classification system, class 1, class 2A, class 2B, class 3. So class 1 is the lowest, which is the safest type of medical devices, which will have minimum requirements of regulation. Class 2 will have more requirements of regulation, and class 3 would be the most serious type of devices which would require maximum regulation, like the stents and the catheters, not the catheters, probably heart valves and things like that. So we need to have a classification system in case we are planning to regulate these medical devices as well.
रिप्रेजेंटेटिव्स ने अपने प्रोडक्ट्स का ब्रीफ डिस्क्रिप्शन दिया।
We are from Shanghai. Our company is professional to produce medical models and simulators in China. Also, we register our brand is made model. Our model is profit to university and hospital to train the students or doctors to. I think it can help them to touch the more enough training skills. And also, I think, especially for our CPR mannequins, it can help all the persons to make the first aid to everyone when someone needs the first aid support. So I think this is a very useful product. And also, this time we took part in this fair in order to improve our products in India, because India is a big market. And also, I think from this, we will help India persons to know more and more clinic training skills, and also we think we can help Indians to know how to make the first aid support if somebody needs in audit.
This is our first time to participate in New Delhi, this exhibition, but I feel this exhibition very good. In the first day, we almost have 100 visitors, so it's a very good success and experience for us. After this exhibition, we hope we can explore the market in North India. Before, we have great business opportunities in South India, and this time I think we will have much more opportunities.
You see, the infection is increasing worldwide, and right now in Delhi we are suffering from swine flu, and I think something new will come again. So our product range protect the patient from these infections. One of the products which we are highlighting in this show is this. You can have a look on that. It is for scissorectomy. because now due to this living and civilization disease in the society, more and more mothers are going for cesarean operation, and this procedure pack is ideal for patients to protect them from any kind of infection.
My job here is to support the German companies to come to India because we see this as a very huge market with a huge potential, and we want every person, every company to encourage to come to India and make this as easy as possible, and this is why we're here at this fair.
I'm here to attend the exhibition because our company want to find the distributors from India. I think our market, our product is good for the Indian market, so we need to find many dealers to cover the whole Indian market. And we call our product the health protector of human beings. So we want to bring more health to Indian people and to all over the world.
उपस्थित लोगों ने अपने विचार व्यक्त करते हुए कहा,
The participation at Medical Fair India 2015 has increased, but we're increasing step by step. So we would like to guarantee a good quality of products. That is the most important part for us. This goes with exhibition or displaying of products as well as visitor flow. We don't want to have a huge amount of visitors. We would like to have a good quality of visitors, and that is something which we can reach at Medical Fair India, and especially at Medical Fair India 2015.
I am happy to endorse a brand called Termix, which helps in the management of potentially malignant disorder, oral submucous fibrosis. India is a country in which the majority of the patients are addicted to tobacco, smoke or smokeless tobacco. Tobacco is a hazard which is well recognized and has caused varied manifestations. One of the manifestations is an oral cancer, which is happening because of the predecessor as oral submucous fibrosis. Termix is an antioxidant. It has got not much of the side effects, and it helps in managing the patient of the challenging patients of oral submucous fibrosis, thereby prevention of oral cancer.
We are the single largest manufacturers of sterile latex surgical gloves in India, with a market presence of over 70%. And we are here basically to meet all of our dealers across North India, to interact with them so that we have a better feel of what the market is and know how to proceed further in furthering our presence here.
I think it will helpful not only with the medical professionals but also all the patients, the doctors and company person and distributors who can provide the service throughout the medical fraternity and the complete society.
We had 454 companies coming from 21 countries. We have got participation from Germany, we have got from Italy, we have got from France, Canada, US, UK, Japan, Korea, China has come in a large way. And as I said, there has been a group participation from these countries as well. So we are very happy with the turnout of visitors that came in 2 days of this exhibition. So it has been a very successful event so far that we have got for this edition.
After visiting this exhibition, I got a lot of information about latest medical technology. Now these technology I believe would be very much valuable for our nation. ऐसा लगता है जैसे जितनी नई टेक्निक्स को हमने यहाँ पे देखा, जो इनोवेटिव इक्विपमेंट्स हैं, टेक्नोलॉजी है, इसका बेनिफिट हम कई सारे लोगों को हेल्थ केयर प्रोफेशनल को डेफिनेट रूप से होगा. एंड मुझे लग रहा है कि जो हमारे मेडिकल फ्रेटर्निटी के लोग हैं, डॉक्टर्स हैं या हेल्थ केयर्स के लोग हैं, जो फिजिशियन हैं, उनको यहाँ ज़रूर विजिट करना चाहिए बिकॉज द काइंड ऑफ इंफॉर्मेशन एंड द न्यू टेक्नोलॉजी एंड इनोवेशन एंड इंफॉर्मेशन अबाउट ऑल दीज थिंग्स, दे आर गोइंग टू बी drastically very helpful for the healthcare fraternity, and this will definitely improve the health for India for a better life.
मेडिकल फेयर इंडिया 2015 सभी लोगों के लिए और खास तौर से विजिटर्स के लिए एक अच्छा प्लेटफॉर्म साबित हुआ.
published since 1992. The main object of this magazine is service, not the profit motive. It gives you name and addresses of buyers, sellers, particulars of worldwide exhibition, useful website, and list of hospitals worldwide. All these things are published free of charge. No condition, no anything you can get it. Circulation is worldwide in 125 countries. Hard copy is also available free of cost. Online as well as PDF are also free of charge. So it is only medical products, services, nothing else. And anybody can have it from me at no charge.
We are basically dealing with various international products. So I just come to find out any new technology or new products from anywhere, any part of the world.
Yeah, I'm feeling very good because my son has taken the stall here and he started a new business here. So very exciting for me.
काफ़ी नए इक्विपमेंट्स मेरे को देखने के लिए मिले जो हमारे पेशेंट्स वगैरह के लिए हमारे को ज़रूरत पड़ते हैं और जो हमारे आगे चलकर भी पेशेंट्स वगैरह के लिए हेल्प मिल सकता है, तो हमें वो बहुत ही अच्छा एक्सपोजर मिला। मैं पहले भी ऐसे कुछ फेयर्स में गया हूँ, बट इस बार का फेयर कुछ काफ़ी अच्छा है और काफ़ी नई चीज़ें इंट्रोड्यूस हुई हैं और स्पेशली डिस्पोजेबल चीज़ों की काफ़ी ज़्यादा इंट्रोडक्शन है, जो चीज़ हमारे आगे चल करके पेशेंट बेनिफिट के लिए बहुत ठीक अच्छे से यूज़ में आ सकता है।
मेडिकल फेयर इंडिया में आम लोगों को मेडिकल फील्ड से रिलेटेड काफी कुछ जानने को और सीखने को मिला। इस तरह मेडिकल फेयर इंडिया 2015 का सफलतापूर्वक समापन हुआ।